My main appointment at U of M is at the Institute for Social Research, where I work with the Health and Retirement Study, which is a longitudinal study of older people. It's been going on since 1992. We have about 20,000 individuals. We interview them every 2 years, as long as they're willing to talk to us, starting when they're in their 50s and following them until they die. I'm an economist. The reason I became an economist is because I was interested in the unequal access to health care that people have. And I originally thought about becoming a doctor, but I spent some time volunteering in hospitals, and I realized pretty quickly that me becoming a doctor wasn't going to solve the bigger problem that I was interested in, which is why some people had such good access and other people didn't. And becoming an economist, where I could think about the unequal distribution of resources and also the types of government policies that might help to correct some of those imbalances, that was what really appealed to me, and so that's the field that I went into. The main subject that my research focuses on is health insurance. For decades, that's been the biggest gap between the haves and the have-nots in healthcare. So the haves are the people with insurance, and the have-nots are the people without. And I was also interested in insurance because most insurance in this country is provided as part of a job. It's a fringe benefit of employment, and as an economist, I'm interested in labor markets, and I'm trained as a labor economist. So it fit nicely with the other things I was interested in. I think the most important issue facing healthcare at this point going forward is not actually something I study. I feel like the Affordable Care Act made a huge step forward for the thing that I've worked on for my whole career, which is thinking about people without health insurance. Going forward, the biggest challenge is to figure out how to change the practice of medicine and the culture of medicine so that we know that we're getting high-value care for everyone. So we've solved some of the problems in terms of people not having access to the system, and I think now the really big problem is to think about what's happening within the system and how can we ensure that the care that this insurance is giving people access to is high-value care. When John Ianian asked me to join the leadership team, I was really happy to do that. The strengths of IHPI mirror the same things that I love about the University of Michigan as a place to be a researcher. Namely, there's a rigorous commitment to good research, strengths in a lot of different disciplines, and also really low barriers to working across disciplines. For example, the project that I'm most involved in substantively here at IHPI is the evaluation of the Michigan's Medicaid expansion, working with the state to evaluate different pieces of that. And that's not something I think that we could have done individually as faculty working in our separate departments, but coming together as a team, and John Ianian facilitated all of that, I think has been really effective. I think we are going to have many fewer uninsured people than we have, and I think we are going to look at the systems like the health insurance exchanges and the Medicaid expansion that we're still having arguments about, and I think we're going to be saying, I can't believe we ever didn't have these things. After my son was born, I remember in the hospital they gave me an envelope on the day we were supposed to check out. There were 2 boxes they could check, and the first one said, you're ready to go home, and that was the one they had checked for us. And the other one said, please stop at the billing office on your way out. And I remember thinking, who wants to stop at the billing office with a newborn? Wouldn't it be great if we didn't have that, if no one had that box checked? And I think we're moving closer to that. What I hope for IHPI going forward is that we will become known as one of the preeminent places for getting reliable, nonpartisan information about what interventions work in healthcare, in health insurance, that we will be synonymous with good evidence that isn't biased.